Well, hello everyone. Just recently I went through the basic trial procedure for the Axonics therapy device. And as I was getting ready for that procedure, I went online looking for information, just trying to find out more about what to expect. Doctor didn't tell me anything. And so as I scoured the internet, I had a really hard time finding good information about the procedure. And so, with that in mind, so I thought I'd go ahead and at least post this video, at least describe my experiences. Perhaps it may help others who, like myself, want to find out more about what to expect. And so, for the Axonics therapy, if you're not familiar, there's two different trials. There's the basic trial, which I went through. There's also an advanced trial. The difference between the two is the basic trial, the test leads for the controller are basically two needles are inserted, into the lower back, each side of the spine, and taped in place, and then the wires connect to external controller, which is taped to your back. And so that's what I went through. I'll describe that in more detail in just a moment. And the basic trial was only about 3 or 4 days long, but the more advanced trial, the test leads are surgically implanted in the lower back. And the trial period is a little longer, I think 2 or 3 weeks. Anyway, but I'll be describing the basic trial procedure, what I went through. And so, basically for the procedure, I show up at the doctor's office, a urologist, and there was 2 nurses there from Axonics, and they performed the procedure. My urologist was in the room, but he was only observing. And so, anyway, fairly basic. So basically, they started me off with 2 vials of lidocaine they injected into my left side of my spine. And so they, in fact, the lidocaine, the injection itself actually hurt just a little bit more, not much, than the actual procedure. But anyway, after they injected the lidocaine, that's when they went ahead and inserted the first needle, and to, again, just as close to the spine, not on the spine itself, still in soft tissue. And anyway, and that there was, I'm not sure if I'd say painful, but it was definitely some discomfort. You can definitely feel the needle going in. So on a scale of 1 to 10, 10 being most painful, I'd say it's about a 3. Basis, and if you got to kind of grit your teeth and get through it as they're inserting the needle. And I would later learn that the needle was a pretty good size needle they put in there. And so after that, once it's inserted, then what they do is they use an external controller to test the lead to see if they have a good connection, to see if they hit the right, they have the test lead on the nerve, the sacral nerve. And so basically, it started out at a low setting, and that ties into the story in just a moment. And then basically, to slowly increase the intensity until you feel a vibration in your buttocks. Feels kind of like butterflies fluttering in your butt. That's what it feels like. Anyway, and then so they. In the event that you don't feel anything, they keep increasing intensity, they'll go up to high, and if you just don't feel anything, that means they have to pull the needle out and reinsert to try again. And then once they reinsert, they do the testing again to see if there's a good connection. Anyway, so for me, they end up having to stick me a couple of times each side to get it right. And so but then once they got to the completed one side, then they went to the other side, and that's when they injected me with more lidocaine. And then they proceeded to do the same process. Interesting little hiccup happened with me. I know this isn't normal, but it's what happened. Anyway, and so they got the other side, and they the first lead they put in, didn't have a good connection. And so it started off with the control device. It started on a low setting and moved up to high. Still didn't feel anything, so they pulled it out, reinserted, got a good connection. But unfortunately for me, the nurse operating the controller failed to reset it to low. Yeah, and so being on high setting, when they hit start to test it, it shocked the tar out of me. I about came off that table. That was painful. I yelled out. I thought I had a fairly high tolerance for pain, but that shocked the tar out of me. Realized it was an accident. It was only about a second long, but still, it was shock therapy. Anyway, yeah, no, that's not the norm, but it happened. And so, anyway, the whole procedure took about 30 minutes total. And then afterwards, they also give you, of course, patient instructions. And that's one of the things I was looking for online, information about what to expect afterwards, what activities can I do. And so basically, they tell you that there's no heavy lifting, so you can't lift anything more than 10 pounds. I also instruct you to make sure that you try to limit any bending or twisting of the back. Basically, they're trying to make sure that you don't disturb those two needles are inserted in your back. And anyway, and so other than that, it's also no strenuous activity, no exercise, and so no cycling, running, weightlifting, none of that, and also encourage you to try to keep your activity on lower side for a few days. In my case, I was able to. Oh yes, I'm sorry. One other point. They also give you a folder with information, and one of the things in that folder is a urination journal to keep track of how often you go pee for a period of 4 days. So basically the trial period. And also too, a nurse, one of the nurses anyway that performed the procedure, they called each day to check on me, see how I was doing, and that proved to be helpful as well. And so after the procedure itself, as far as recovery is concerned, there is no at least significant pain after the procedure. Maybe some discomfort, but that's to be expected. And really, I could have easily gone back to work that day if I needed to. And so the interesting too. So at the 8 hours after the procedure, I happened to notice that there was some bleeding on my lower back. They tape you up pretty good in the back side. There was about an 8-inch square area where they tape everything up as far as the controller, the wires, the leads. And the lower part of that, I noticed was some blood, and so that blood got on my clothing, which was a bit concerning. There was nothing in the patient instructions about bleeding. So I called the nurse, and she described as, well, bleeding isn't necessarily common per se, but it can happen. And it said, and it's more likely to happen if we happen to have to stick you more than once. And that's when she described the needle was a pretty good size needle, apparently so. Because 8 hours after the procedure, I was experiencing some bleeding. Minor. Anyway, so yeah, the bleeding is actually not uncommon for anywhere from like 12 to 24 hours or so after the procedure. So anyway, I went ahead and they just said they put some gauze over each site. I ended up reapplying some gauze and taped myself back up. Anyway, again, they just say bleeding isn't necessarily common, but it can happen. And then also too, there was some soreness for the first maybe couple of days afterwards. Nothing major, just some tenderness in the area, the lower back. And also too, after a couple of days of wearing this, everything, the device, everything taped up, I started experiencing itching, much like you would if you had a cast on your arm. And so one other note is that they didn't give me any instructions about sitting. When I first got home, for most of the day I was sitting on the couch. I started thinking about it, perhaps maybe the reason I was experiencing some bleeding back, my lower back, Perhaps maybe because sitting back on a cushioned couch was putting some pressure on where everything was at. So I elected to go ahead and from there on out for the trial period to go ahead and just sit on a chair. I just grabbed a dining room chair, not as comfortable, but it took any pressure off my lower back. And also I want to make sure I didn't disturb those test leads. And then, so for me, the results is it worked great. The nurse did explain to me the main purpose of the trial is simply to see if you respond to the treatment. She described that for the actual implant device, is far more capable than the trial device. She described in detail all the adjustments they can make with the actual implant device. It was like 3 or 4 different things they can change. And so she described to me was that the main thing they're looking for is see if you respond to the treatment. In my case, I was able to reduce my times of going to urinate each day from 21 down to 14. And again, she did describe that that's just a trial device. For the actual device, we'll be able to, those numbers will improve. And then for me, I was able to reduce my urination time from maybe 45 minutes to an hour down to every 2 to 3 hours last couple of days of the trial period. And so it worked well for me, and I was able to reduce my urination at night from 3 times a night down to 1. And so I was pleased with the outcome. And so I've been approved for the implant. I'm waiting on the doctor to schedule the surgery now. And so, and then one other note is for the actual removal of the device, I was wondering about how that would go. There's no lidocaine for the removal, but it was also pain-free. Very quick, maybe 2 to 3 minutes total. There was no pain at all removing the two leads, even though the nurse that removed the leads also said they were good sized needles. I never looked at them. Wish I would have. Anyway, and so I hope this video has been helpful to you. If you have any questions, please don't hesitate to leave those in the comment section below. And so wish you best of luck. Take care.